of the vaccine begins tomorrow. Now, on one hand, there is relief, there is hope. On the other hand, there is some anxiety, there is some hesitancy as well. In this episode of Government Matters, before this very important event, I have Abantika Ghosh, who is our health editor, who's been heading a COVID coverage, who will tell us everything that we want to know about this vaccination drive, all the numbers, all the details, what are the bottlenecks, possible bottlenecks, and what is the government doing to address them. So do start sending in your questions right away. Abantika, so okay, I don't even know where to begin, because it's, you know, it's a big thing, and we've waited for months to sort of see this day. There are 2 vaccines which we know we are rolling out tomorrow. So let's first talk a little bit about the numbers. Who is being inoculated in the first phase? How many people does that comprise of?
First phase, we have identified, as the first phase, we have identified 30 crore people, which is healthcare workers, frontline workers. Frontline workers would mean your armed forces, police, sanitation workers. That is 3 crore. And that 3 crore is what we right now have full clarity on, right, in terms of who pays for the vaccine and the logistics and all that. After that come people with people aged less than 50 years and people with comorbidities. And all of these 4 groups together is
people aged more than 50 years.
Aged more than 50 years, yeah, and less than 50 years with comorbidities. Right, sorry. So all these 4 groups comprise 30 crore people. But the thing is, people with comorbidities is not one monolith. Even people aged above 50 years, we don't know if that's a monolith, because it's possible that we will do it first 60 years and above, right, then 50 years and above, depending on how your vaccine supplies go. So, and we have to understand that in all of this, the time, how long it will take, the limiting factor is going to be vaccine availability, because the last time we did 32 crore vaccinations in mission mode, that was in 2017 when we were doing the measles rubella vaccination campaign among children, and that took us about 2 months. So logistics wise, that's the time it should take. But here, it probably will take a little more, because we don't know what will be the vaccine flow, how it will come. You know, we have some idea about the manufacturing capacity of the 2 manufacturers,
right,
and we are hoping some others will get cleared in the coming days. But even then, we have international commitments. The country has international commitments. Also, Serum Institute has international commitments, because it's a part of COVAX.
Right.
So it will have to give some vaccines for the low and middle income countries.
Anyway, giving to Brazil. Yeah.
That's right. And there'll be more of that, because they've received this funding from Bill and Melinda Gates Foundation on the condition that they will give to LMICs. That will have to be more than just India. India is also an LMIC, but it'll have to be more countries than just your own country. So that is going to be a very crucial factor in the coming days in deciding when we complete this target. In deciding, leave alone 30 crore, in deciding even when we complete this 3 crore.
Yeah. Right. Okay. So now there are 2 vaccines, Covaxin and Covishield. Who gets what?
It's a coin toss.
It's a coin toss.
Yeah.
So now, because it's a coin toss, and because there have been questions around the Bharat Biotech vaccine, there have been concerns around it. Is there a sense of unease or anxiety among, say, frontline workers, healthcare workers?
Absolutely. So, right now we know the government hospitals in Delhi tomorrow, they are all going to give Covaxin, and we were just talking to some of the doctors there on the record, off record, and there is a lot of apprehension about it, and also the fact that you can't choose, but you can opt out. So because Covaxin is supposed to be delivered in clinical trial mode, what that means is that you will have to sign, there will be a process of informed consent. You'll sign a document that says that yes, I consent to receive this vaccine, and there will be regular follow-ups. How it's different from a clinical trial is that there's no control group, so nobody is receiving the placebo.
Right.
But for the trial group, the protocol is exactly the way it happens in a clinical trial. That's the idea of clinical trial mode. But here's the problem: if you don't consent, then you just miss your chance.
you don't know when your
then
chance will
don't
come.
have the option of saying I don't want this, but I do want Covishield as and when you get it. You don't get that option. At least that's the sense we get so far, that you cannot choose. And so if you opt out, you opt out of the process itself. You don't just opt out of one vaccine.
Right. Okay. So now, going forward, there is, as we've mentioned, there is a bit of hesitancy, and not just about the Bharat Biotech vaccine, not just about Covaxin, the vaccine as a whole, the concept of this vaccine. What is the government doing to address that kind of hesitancy, that anxiety? Because that is going to be a key factor when you roll it out to the public.
Yeah, so the government has, they have planned an elaborate information campaign. They have given out several directives to states on how to counter it. So one of the things it says is that counter misinformation immediately. If there's a WhatsApp forward going out saying something which you think will contribute to vaccine hesitancy, be very quick to counter it. Don't wait like for a day, like usually happens in government. Don't do that. Just quickly counter misinformation with the right information. And then they are also trying to they're also trying to rope in some, celebrities who can talk about it. People like Niti Aayog member, Dr. V.K. Paul. So he's a doctor himself. So he comes in this first category of people. He said, I'm ready to take the Covaxin anytime. So that sort of, people who are sort of, they're important people in the system.
Influencers.
They should take. Now, one thing is that, last week when there was a meeting with the states, many states had said that panchayat members, MPs, MLAs, some states had even said that civil servants should be a part of this frontline workers and they should get vaccinated. But when Prime Minister Narendra Modi gave his address at the CM's meeting, he was very clear that we don't qualify. We are not in that priority list. So basically the idea being that please don't try and jump the queue.
Right. But most would, as we've done a story, most would qualify to be in the 50 plus category. So the next whatever
Right. And I'm sure many more would have comorbidities
as well.
As and when the list comes out, because we still don't know what are the comorbidities that make you eligible.
Will be included.
Yeah.
Right. All right. Okay. So Radhika Ghosh wants to know, cases are so low in India. Have there been recent sero surveys to confirm herd immunity? On the basis of that, does the general public need to be vaccinated?
No. The last sero survey we had was in August, September. There is one happening right now in Delhi, but that's Delhi government, that's just Delhi. And there is one sero survey that we are hoping there would be India sero survey results soon. But before that comes, we can't say this.
Right.
There is no sero survey data to say if we have reached herd immunity, but there is of course that supermodel projection of India having missed 90 infections for every case. That gives our figure right now at something like 90 crore infections. But that, as they have made very clear that it's not based on any sero survey, it's this model,
it's
statistical projection and all of that. So,
So she has another question, that's Radhika. When could we expect the vaccination to be available in the private market?
There's no official word on that yet, but so Serum Institute has actually said that they make it available as early as as early as March. But I was talking to somebody in the government, and the sense that I got is that it would be about 6 months, maybe June, July before you can do that, because the thing is, for these 30 crore vaccinations, the priority groups, 2 doses per person, we need 60 crore, 10% wastage, we need 66 crore doses to vaccinate 30 crore people. Serum Institute has said that from February, right now they have a 5 crore stockpile, and Bharat has, I think, another 2 crore stockpile. Serum has said that from next month they will be in a position to manufacture 10 crore doses per month. Bharat is actually targeting 70 crore in the entire year. So that we don't know what is the immediate, from next month onwards, what's the number of vaccines they'll roll out, that we don't have any clarity on. But going by serum number and, some sort of assessment of Bharat, and then you have again those international commitments and all of that. So 6 months looks like a reasonable thing, unless there are several vaccines in phase 3 trials. Zydus Carella's DNA vaccine is, again, it's an indigenous vaccine. It's just got clearance for phase 3 trials, and the government has gone on record and said that you can expect some of these vaccines. Also, Sputnik is in phase 3 trials right now. So, government has gone on record and said that you can expect some of these vaccines to be given emergency authorization at some point. If that happens,
then you have a larger pool.
A larger pool, but then again the limiting factor is going to be what is their stockpile, what is their manufacturing capacity.
Right, and costing.
Of course, costing is a very important thing, but for Zydus, because it's indigenous,
right.
So there would be some sort of understanding on the costing in any case. Sputnik is there. Also, the Pfizer application is pending. Though I think it's quite unlikely that Pfizer will be a part of the national program. And also there are some sticky issues there. The government wants them to do a bridging study. Then Pfizer is very keen on an indemnity that, the compensation, that if there is any legal case in this, the government should compensate the recipient and it should not be the liability of the company. But that does not happen right now for any vaccine, and it's not going to happen for these vaccines either. Every vaccine that the government of India buys for the universal immunization program, the liability is of the company that it buys it from. There is no such system of indemnity anywhere, and that will apply also for the COVID vaccines.
Okay. This is from Hitesh Nautiyal. He's one of our regular viewers. My question is, can we really trust a vaccine whose third phase trial isn't complete yet? Will you please also elaborate on the distribution plan of the vaccine? So I think the first one we've addressed in a fair amount of detail in an earlier episode of Government Matters.
Right, yeah.
So, if you would like to log on to that, and I can request our team to just put the link to that in the description of this video. But let's talk about the second point, which is the distribution plan of the vaccine.
Of Covaxin?
Right.
Okay. So both vaccines are going to be distributed in the proportion of their availability and the proportion of recipients that have been registered in every state. Now for Covaxin, what has happened is the total number of vaccine doses available to the government currently is 55 lakh. So when we were talking to the states have, for example, Delhi has received 20,000 doses. Many states have received between 20, 25. That is a very small number to start the program on, because see, you cannot give one dose of Covaxin and the second dose of Covishield. You need to have enough to vaccinate your X population, and you have to have 2 doses of the same vaccine. So obviously many states have said that we are going to start with the vaccine of which we have enough supplies.
Right.
Covaxin is a backup. But as Covaxin rolls out, I'm sure more states will get into the Covaxin thing. But also, and some states like Chhattisgarh have clearly said that because there is no efficacy data, we will not be using it. Now, see, I would like to say one thing about that first question. Trust means what? If you want to trust the vaccine to be safe, then probably you can trust it.
Right.
But if you want to trust the vaccine to protect you from disease, to reasonably protect you from the disease, that is where the trust factor in Covaxin is problematic, because we don't have that data. It is perfectly possible, like happened for the Sinopharm vaccine, that in the final count, the actual efficacy, who knows, even goes below 50%.
Right. So the efficacy is the question, not the side effects or the safety of the vaccine.
Right, yeah.
Okay. Nikhil Dubey, when can we expect the Sputnik V vaccine to roll out in India? Can we expect full efficacy data from Bharat Biotech? What would happen if the efficacy is lower than the threshold? Okay, so we've talked about Sputnik. Let me just sort of reverse this question a little bit. That you've given the Bharat Biotech vaccine, Covaxin, to many people, to frontline workers, healthcare workers, etc. And then you get the efficacy results of the vaccine, and you realize, as you mentioned, that it's less than 50%. What happens then? Can those people be given another vaccine? Is that safe to do it? I mean,
so they can be given another vaccine after a reasonable period of time. There is there is this very detailed do's and don'ts that the government has shared. There has to be a reasonable amount of gap between the 2 vaccines if you have to change. So if required, COVID-19 vaccine and other vaccines should be separated by an interval of at least 14 days. This is for other vaccines actually.
Right.
But for the COVID-19 vaccine, ideally the second dose has to be the same, but it's it's not impossible to give a different dose, because remember, UK is doing just that.
Right, right.
And that there are problems with that, because people are saying that that's what causes mutation. When you give subpotent doses of 2 vaccines, that's what causes mutation. That's a different conversation. But yeah, if it's not efficacious, then at some point of time you'll have to revisit these people and give them.
Right.
So also, you know, in this case, you know what you have got. People who have been part of trials, for example, in the UK, they have got the other vaccine. So they've been unblinded and they've got the other vaccine if they are in that priority categories. At some point of time, that will have to be done.
Okay.
And there was another question, when the efficacy data will come.
Yeah, when will the efficacy data of Bharat Biotech come?
Yeah, so the government and the company are expecting the efficacy data to be in another month or so.
Okay. All right. There's a question. There are 2 questions from Tarush, who's another of our regular viewers. Will the government make vaccines compulsory for all citizens, and how will the government track the status? Will there be a certificate for those who've got vaccinated?
Right now, it's not compulsory for anybody. You have the right to refuse, whoever you are, even if you're in the priority group. It's voluntary. It is not mandatory. Nobody can force you to take the vaccine. And yes, once you have been vaccinated, you will get an e-certificate of vaccination that you can store in your DigiLocker, in your phone, wherever.
Okay. Lalit Spam, that's the user ID. Given our demographics and lower death rates and flattened curve, despite having opened up, should we not focus on vaccinating the old and the comorbid? So the focus is staggered like that.
Yeah, right now we are vaccinating these people because they are at a higher risk, because they are in the front lines. Healthcare workers are constantly exposed. Frontline workers are constantly out on duty. So a lot of the old people have, so the reason why we need to vaccinate them actually is that, you know, their normal lives have to be restored.
Right.
You cannot keep people inside their homes
Absolutely,
ever. But that is why their exposure levels are lower than these people's.
Right. Okay. Kishore XR, what does the protocol say if the candidate is vaccinated already, needs to test again before traveling? So what happens if you're vaccinated and you want to travel abroad, just that vaccination certificate is enough?
No,
that's the question.
No, that will depend on the requirements of the country that you're traveling to. All countries have put in place India, for example, has put in place some requirements for people traveling from the UK. So that will not do, because see, a lot of these vaccines will actually not prevent infection. They will prevent serious disease. They will reduce the period that you're infectious, and it will, so what they will do is, they're not sterilizing vaccines. The virus will still enter your body, but your body will know how to fight it.
Right. So it gives you immunity to deal with the virus.
It gives you immunity, but it does not mean it prevents the virus from entering.
Okay.
So you will still need those tests.
Okay. Tarush, I'll take this last question. Who will take the responsibility if there's a side effect with the vaccine? Well, you did mention that there is no indemnity in.
No, and India doesn't have a compensation, a government compensation program either. For example, Canada has just announced that if you have some major side effects, you will be compensated by the government. India doesn't have that sort of a program. So.
Yeah, so there is no real answer to this question. All right, Abantika, thank you so much. This was very helpful indeed to get a 360-degree view of what the vaccine rollout for COVID in India holds for us. Thank you for watching. Abantika, you have a long day tomorrow, so good luck for that. Thank you for watching Government Matters. Have a good weekend.